This video explains the hospital's process for small dose administration. All IV tubing has a volume. For older patients, the volume as a percentage of dose is negligible, but when giving IV meds to small patients, it can be greater than the dose itself. The adult and larger patient practice is to hook up the medication, allow it to run, then remove the tubing and flush. In order to give the full dose over a prescribed time, we follow a different practice for small doses at this hospital. In order to give small doses appropriately, a medication needs to be advanced through the tubing to the insertion site of the line and then flushed at the same rate. If the dose is smaller than the tubing volume, wash hands, don gloves, clean the hub for 15 seconds, and slow push the medication. Attach the flush, slow push the remaining volume of the tubing. Place the flush on a pump, program it with the medication using the rate volume button. The rate is the ordered rate, the volume is the volume of the tubing minus the amount of the medication. When the flush is complete, turn off the module. An example, caffeine 1.4 milligrams in 0.7 mLs for a 1.4 kilo patient in the NICU. Slow push the caffeine into the med line and attach the flush. Push 0.8 of normal saline. 1.5 total volume minus the 0.7 caffeine equals 0.8 mLs of normal saline. Using rate volume, set the pump to run at 1.4 mLs per hour for a volume of 0.7. The 0.7 of medication will infuse over 30 minutes. If the dose is larger than the tubing, wash hands, don gloves, clean the hub for 15 seconds, and slow push 1.5 mLs of medication. Place the syringe on the pump and program it for the medication using rate volume. The rate is the ordered rate, the volume is all. When the syringe is empty, clean the hub, attach the flush, run the flush at the ordered rate. The volume will be 1.5 mLs. When the flush is complete, turn off the module. Example, vancomycin 20 milligrams in 4 mLs for a 3 kilo patient in the NICU. Slow push 1.5 of vancomycin. Put the syringe on the pump and program the vancomycin using rate volume. The rate is 4 mLs per hour to run the vancomycin over 1 hour. The volume is all. When the syringe is empty, attach the flush. Using the same programming, but change the volume to 1.5, which is the volume of the tubing. Thank you.